Hi, thank you for all your comments and thank you for all of you who've subscribed to my videos and for watching my content, and I'm really grateful that you found it of value and found it useful. In this next series of videos, what I'm going to be doing is actually going through some of the Q&A and the questions that you've asked, and I think it would be really useful if I did these as separate videos themselves rather than just answering the comments in the videos. So thank you so much for first of all the comments, and I'm just going to focus this video on a couple of questions that have come around the fibromyalgia series of videos and particularly the overlaps that have been asked. So Sheila has asked if fibromyalgia and rheumatoid arthritis can coexist and can one be confused for the other. This is really a common enough question, and in reality, in clinical practice, it is very easy to confuse some of the more common symptoms that people get in terms of the general body symptoms. There are clear-cut diagnostic criteria for rheumatoid arthritis, of course, in terms of the hand swelling, in terms of the blood test that would show a clear presence of what's called the rheumatoid factor, and inflammation will also be elevated when there is an active rheumatoid arthritis ongoing. But there are many other symptoms that do overlap, and indeed rheumatologists are of the opinion that up to 25 to 30% of rheumatoid arthritis patients will eventually get a diagnosis of secondary fibromyalgia. What does that mean? It means that in people with rheumatoid arthritis, the immune system gets already hypersensitive. Over a period of time, it can happen that the immune system starts to trigger and sensitize the nervous system as well, which means there will be patients in whom the rheumatoid factor may be positive, but the acute markers of inflammation, what are called CRP, the C-reactive protein, will not be elevated. They'll actually be normal, but patients will have symptoms of tiredness, of fatigue, of pain that is there in many joints, of sleep disturbances, of concentration problems. So when all of these happens, then it is easy to confuse the diagnosis of fibromyalgia and rheumatoid arthritis. And so actually now rheumatologists actually feel that you can have secondary fibromyalgia on top of rheumatoid arthritis. So I hope that that's really useful, and it's useful to understand the overlap, the confusion, and the difference between them. Another question that is in the same vein actually is around the fact of getting long COVID in the presence of fibromyalgia. This is again a similar kind of confusion that I have had a lot of patients in my long COVID clinic who do have a pre-existing diagnosis of fibromyalgia. And then they have COVID, an acute COVID episode that might be very severe, in which case they might go to a hospital, or it actually might be mild or moderate where they manage the symptoms at home. But 2 or 3 months later, they are left with significant fatigue. They might have pain that is present in many parts of the body. They might have aches and pains in some joints. They might have brain fog and focusing problems. They might have concentration issues. So in that sense, you can see that the symptoms that patients are left with after an acute COVID episode will be quite similar to again what they experience with fibromyalgia. This is still an area of a little controversy, where some rheumatologists and some general practitioners will feel that people with fibromyalgia can get a flare-up, but there are others who feel that you could have long COVID and you can have fibromyalgia coexisting, but the way to distinguish it is that long COVID has got all those other symptoms that is seen often in COVID patients. It's not just about tiredness, fatigue, sleep disturbances. You might have autonomic disturbances where your heart rate is very fluctuating. You might have POTS-like symptoms. You might have stomach disturbances, and you might have other symptoms that are more characteristic of long COVID, like smell and taste changes or lots of pins and needles. So this is something that is still controversial. In my opinion, I think that fibromyalgia and long COVID can overlap, and people can get a significant flare-up of their fibro symptoms when they have had acute COVID, because ultimately a viral infection is going to sensitize the immune system and sensitize the nervous system, and fibromyalgia is a condition where the nervous and immune systems are already sensitized, so it's not surprising that an acute viral infection just elevates the sensitivities of both systems. I hope this has been useful. In the next video, I'll cover some more questions and answers from viewers. Thank you for watching this video. Hope you have a good day. Hi, I hope you enjoyed that video. If you want to hear and see more, then please click the subscribe button and hit the notifications button so that you'll know when the next video is released.